Patellofemoral joint is a diarthrodial joint which is supported by numerous structures all around it. These are usually stabilizers. Yeah, these usually are the stabilizers which are static as well as dynamic stabilizers. They help in stabilizing the patella. When knee is being flexed, that time this patella displaces the force of vectors of quadriceps and patellar tendon away from the center of rotation of the knee, which helps in improving the efficacy of the quadriceps contraction. What is Q angle? That's quadriceps angle is angle between line of action of the quadriceps tendon and the patella. It is usually measured at 20 degrees of flexion. Normally it is up to 17 degrees, and if anything beyond 20 degrees is abnormal. There are certain important radiological parameters which are based on X-rays, CT scan and MRIs. Most of them also overlap with each other. So when Blumenstrat's line is drawn, if the inferior pole of the patella is not touching this Blumenstrat line, it is called as patella alta. And there are various other indices which are taken on the lateral radiograph of the knee, most common being Insall-Salvati index and Catton-Deschamps index. So these indices usually range from 0.8 to 1.2. Anything beyond that is considered as abnormal. Dijor has given classification for the dysplasia of this femoral condyle. So there are 4 types, type A, B, C, D, depending upon the morphology of the trochlea of the femoral condyle. So when X-rays are taken to quantify the patellofemoral instability, the various common angles are sulcus angle, where medial and lateral trochlear facets lines are taken, and the angle measured is called as sulcus angle. Normally it is 140 degrees. Another important angle is lateral patellofemoral angle, where line connecting both the trochlea is taken and the line tangential to the lateral trochleal facet is drawn. The angle form is called as lateral patellofemoral angle, and normally this angle should open laterally. If it is not, that means there is something abnormal happening with this morphology. Another angle is a tilting angle, where the similar line is drawn on the anterior part of the trochlea and another line through the axis of the patella, and normally it should be less than 55 degrees. Similarly, there is a ratio called as lateral shift ratio. You draw the tilting angle as shown, then take a vertical perpendicular at the level of highest point of the lateral trochlea, and then the ratio between line B, C and AB is called as a lateral shift ratio of the patella. It helps in knowing how much patella is shifting laterally. Another angle is a congruence angle. You draw the sulcus angle, bisect the sulcus angle in the center, then draw another line through the center of the patella. The angle formed between this bisecting line and the central line is called as congruence angle. CT scan also helps in giving more important parameters like X-rays or MRI. There is a classification based on CT of the malalignment. Then let's look at the MRI. MRI helps in knowing the soft tissue injuries like MPFL injury, or if there is any osteochondral or articular damage. Another parameters which can be checked on CT scan as well as MRI being trochlear depth. Connect the posterior condyle, then take the deepest point of the trochlear groove, and that should be subtracted from the mean of medial and lateral femoral AP diameter. So that gives trochlear depth. Another way of measurement is connect to highest point of the femoral trochlea, then connect the deepest point into the trochlear groove, and the distance between both of them is a trochlear depth. Anything less than 3 to 5 mm is considered as pathological. Lateral trochlear inclination, draw the posterior condylar axis, then take a tangential to the lateral facet of the femoral trochlea, and the angle form is called as lateral trochlear inclination angle. Normally it should be more than 11 degrees. If it is less than that, then it's considered as abnormal. Facet symmetry is also important, where you take the length of medial facet and which is divided by the length of the lateral facet, and the ratio is calculated. So if the ratio is less than 40%, it indicates dysplasia of the facet. Patella alta also can be assessed with the help of MRI. Then another important structure is patellar tilt assessment, where posterior condylar reference axis is drawn, then a line is drawn from the maximum width of the patella. The angle formed is patellar tilt angle. Normally it should be less than 20 degrees. The most important is tibial tuberosity to trochlear groove assessment. How it is done? You draw the posterior condylar axis at the level of the trochlear groove. In the same plane, you draw axis at the level of tibial tuberosity. When both of these superimposed with each other, the distance between them is TTTG assessment. So if it is more than 20 mm, it is abnormal. Less than 15 is usually normal. So in summary, there are certain important parameters based on patella, that's patellar height, patellar tilt on the radiograph as well as CT, patellar displacement, patellar congruence. Then some are based on femoral trochlea and another related to translational forces like quadriceps angle and TTTG distance. Thank you very much.